All right, good afternoon, everybody. You got Corey here. We appreciate all of you joining us this afternoon. Also, like to welcome Charlotte Mayor Vi Lyles this afternoon to talk to all of you. Mayor, we appreciate you taking the time. What we're going to do is we're going to have a session where reporters will be able to ask you questions. We'll introduce them by name. As a reminder to reporters who are listening in on the call, you'll need to utilize the Raise My Hand feature in WebEx to indicate that you'd like to ask the mayor a question, and I'll introduce you by name so that you can ask your question. A video file of today's session will be provided to all of you immediately after this event is over. And with that, I will turn it over to Charlotte Mayor Vi Lyles, who will make an opening comment.
Good morning. I think it's still morning or maybe a little bit after. So to all of you that are calling in or are going to participate in this, I want to say thank you. You have done tremendous work, and I know how much work you've been doing, reading and viewing all of you. It's making a real difference. The reason that I'm doing this today is because of your connections and networks that make it possible for us to get the word out about what we are doing as a community. But more importantly, I think that people expect to see me talk about this, and we want to do that in a way that gets to all of our audiences, our entire community, and you're our best method for doing that. So thank you for taking the time out this morning to participate in this. Now, this is a little different for me. I'm talking to a camera and can't see you, but I think that this is our best way to do it and follow our social distancing rules and requirements, because I want to be an example for everyone else in the city of what we're trying to do to flatten the curve of the coronavirus. So with that, thank you, and let's go ahead and get started.
Terrific. Thank you, Mayor Lyles. At this point, we will turn it over to Allison Kuznets from the Charlotte Observer with her question. Allison, go ahead when you're ready.
Can you hear me, Corey?
Yes, I can hear you. Really, Allison. This is Vi.
Okay. Mayor Lyles, can you talk a little bit about what the city is planning to do to offer relief to small businesses? Obviously, a number of businesses have to dramatically shift their operations based on the stay-at-home order and what Governor Cooper's already set out. So what relief is being offered to those small businesses? What plans are in the works?
Allison, that's a great question, and one that all of us are trying to address. We know that small businesses hire over 70% of the workforce. Many of us have been driving past places where small businesses are going to have to close, from the order from the governor for the places of amusement to all of the other places like our gyms and nail salons and hair salons, all of those kinds of things. I think the most important thing that we have to do is continue to lobby at the federal level for the stimulus package, and to make sure that that stimulus package includes small businesses. But I think we also have to go a little bit further. You know, this is a new normal for us, and so we're looking very closely at what local funding we can have to match anything or to supplement anything that that stimulus package would provide. It's something different, but I think that this time that we're in is requiring us to do something different. So look for that in the next couple of days. As soon as we find out what the federal package will do, then we'll examine it for gaps and try to close those gaps.
All right, next we're going to go to Eric Spanberg. Mr. Spanberg, go ahead when you're ready.
City itself, can you give us an idea what percentage or what number of city workers are telecommuting at this point? And then secondly, I'm wondering what you're saying to city employees in terms of not only keeping them safe, but trying to keep morale up at such a strange time in the city's history.
We've done a lot of work in that area. One of the very first things that I want to say is that the city manager has sent out a letter to all employees thanking them for what they're doing to help stop the spread of this virus. So what we're doing is working in staggered shifts. So many of you are familiar with the floor that the mayor's office is on. And so we may have one or two admin people there with the city manager and the crisis management team, which includes the assistant city managers. But the very first initiative that we took was to make sure that our public safety officers and our sanitation workers had the right equipment and tools to work with in terms of making sure that we had, lots of hand sanitizer, lots of posting of what the rules are for social distancing, and we've all had to adjust. But we're also doing contingency planning, particularly around areas where we know that sanitation is important. People are at home, and so we've got to get garbage collected and picked up. But we're working on what we're doing and also a business continuation plan, and just in case something more urgent comes up. So we're staffing for regular processes now with police and fire. And I want to say thanks to all of them for what they're doing, as well as thinking about contingency. I think in your world it's called a business contingency plan, just in case these next 3 weeks don't work to flatten the curve.
Next up is Hannah Smoot. Hannah, when you're ready, go ahead with your question.
Thanks. Speaking of flattening the curve, I wanted to talk a little bit about the letter from Atrium and Novant that was attached to the proclamation that you signed, Mayor Lyles. In that letter, Atrium and Novant said that we have hours, not days, to flatten the curve in a way that does not overwhelm critical service. What is that point that we would pass that point to not overwhelm critical service? And is the city doing anything to support hospitals that may be, running low on beds or supplies?
Well, I want to say first that when we look at this and you're saying, what are we doing? This is something that is such a national issue. I think that we all know that we don't have every tool that we'd like. We don't have every piece of equipment that we would desire, but we are trying very hard to work at every level to get that material in. Novant and Atrium have been very involved and very engaged from the top to the bottom, from where the CEOs are saying and talking about, why did we have to do 3 weeks? Why couldn't it be 2, 1, 6? They are actively participating in every policy decision being made in Mecklenburg County. The other thing that I would say is that that we've had a lot of our healthcare workers working so many hours of overtime. We've worked hard to make sure that they have child care when it's needed, that they have a place if they can't get home or they don't want to go home to their families, that they can have some respite at one of the hotels in town. So these are small things that we're doing, but when it comes down to making this ultimate decision on respirators, ventilators, and masks, those are things that are national issues. And what we're doing every day is monitoring and working with our federal delegation and the White House to make sure that they are supporting the efforts that we have locally here in Charlotte.
Our next question is going to go to Joe Bruno. Joe, go ahead when you're ready.
Right. You hear me, Mayor Lyles?
Yes, I can, Joe. Thanks for a question.
Thank you for taking it. Just two questions. One is really quick. Have you been tested for COVID-19? And the second question is, would you like to see Charlotte City Council possibly lower the property tax rate, given the economic hardship that a lot of people are experiencing?
Well, the first question is, I have not been tested. I have not had any symptoms. I've been working a lot. I might be a little bit tired, but I don't think that I have had any symptom that would actually require testing. And I don't want to take a test kit away from someone that really needs it. So we are going to follow the guidelines for testing, and right now I would not qualify for going to take up something that's a valuable asset for our healthcare providers right now. The second question, everything is on the table when it comes to what we have to do to recover from this. A lot of it's going to depend, again, on the federal stimulus package, but we are going to work really hard. So whether it's the property tax going up or down, whether or not we are providing tax relief for our seniors and for people who have lost their jobs. We can't ignore this crisis that's going to be created economically for our citizens. Our restaurant population, many of all of you know that 1 in 9 of our workers are in the hospitality industry, and that industry is not doing right now. I encourage people to go for takeout, but you know that this has been one of the cases that where people have been notified pretty quickly by email that they were laid off. And so we're going to have to look carefully at everything that we're doing. And that could range all the way from our property taxes to how we do our bond referendums to what kind of reductions or changes we would have in our fund balance. Everything is on the table as we begin to battle this economic loss.
Okay, terrific. Thank you. We're next going to go to Alex Shabad. Alex, when you're ready with your question, go ahead.
Mayor Lyles, two related questions about the stay-at-home order. What do you say to people who are confused about if they are required to stay home for their jobs? A lot of questions out there about if this job or that job. I know there's a couple dozen that are allowed, considered essential jobs. And that's the first part of the question. The second part is, how strongly do you want to see the city cracking down on people who are violating the stay-at-home order? Is it police pulling drivers over, stopping people gathering in groups? What will it look like?
Those are the two areas that I have been getting the most emails about. What is essential and how are we going to enforce this? So that's really a helpful question to get out. So let me tell you what I've been saying as mayor. You know, the proclamation that we have includes the businesses that are essential. And so whenever someone's inquiring to me about what the essential definition is, I say, please use common sense. The order is really to help our city continue to be safe and to not have what's taking place in New York happen here in Charlotte. So this is what I really say. Making the choice to stay open if at all needed is an important one. And my hope is that anyone making that decision uses and understands the gravity of that decision and takes it very carefully. So on the essential, this is about us. This is about what we do to help each other. I know businesses are suffering, and I know that sometimes people have questions about what essential means. But the bottom line is that if we want this 3-week practice to really have good results, then that's the only way that we can do it, by requiring essential businesses to work and asking others not to. In terms of enforcement, all of us know that CMPD and the other town police departments have the ability to enforce the law. But our first option is to educate people, to get the word out that what we're doing is social gatherings of 10 or fewer people, that we're asking you to stay at home. So those are the things that we're doing. So what we would hopefully do is have education. But on the enforcement side of it, we are not going to be following people around. I got a question today whether or not someone needed a letter to go to work. We're going to take a reasonable approach. We're going to review it constantly to see if it's working. But we are not planning on having police officers stopping people unless we get to that situation where we have that need, and that's not happening now. The other thing I wanted to say is that people can call in to our website or join our website if they think something is happening that requires someone that needs some education. So what we would do first is just send out the message of what's important to do and why we're doing it. And I believe the citizens of this city, the residents that we have, will understand that and will do their part.
Okay, next we're going to go to Brett Jensen. And just a reminder for our reporters, you may be only asking one question at a time right now. However, if you do have a follow-up, you can re-raise your hand and we'll bring you back in. But with so many folks on the line, we do want to give everyone an opportunity to at least ask one question. So if you do have a follow-up, don't think you're getting shut out from that. So Brett Jensen, when you're ready with your question, go ahead.
Yes, Mayor, thanks for doing this. To follow up on Eric Spanberg's question to start things out there, do you have a number or a specific guess as to how many or what percentage of Charlotteans are not being allowed to work right now?
We do not have that number. At least I do not have that number. I expect that if you look at overall employment in this community, the healthcare system is in the top 3, and banking and finance would be second. And both of those are considered essential for under this proclamation. So my assumption is that the city, overall, those people employed in those 2 sectors of healthcare and banking and finance are working.
Excellent. Our next question is going to go to Chandler Morgan. Chandler, when you're ready with your question, go ahead.
Mayor, precautions play in the spread of the virus nationally. So should the city of Charlotte continue operating buses and light rail, or is that too much of a risk?
Actually, that's an excellent question, and we do know that if you do not follow the protocols for cleaning of our buses and trains, that would be a problem. But we are following a very restrictive protocol around how we're doing the cleaning. And then we also have to remember that transit is an essential part of the employment, especially for a number of our healthcare workers. So working with the policy group, listening to Atrium and Novant, we need to have buses and trains running so that people can get to work, and especially in those in the healthcare sector. So we're doing everything in terms of making cleanliness and sanitation the highest priority on our buses, as well as protecting our bus drivers, and we're with physical barriers as well as barriers of sanitation as required. But buses are essential to getting people to work. Particularly, we've focused on getting the healthcare folks to the places that they need to be.
Excellent. Our next question is going to go to Diego Barahona. Diego, when you're ready, go ahead.
Mayor, we have many questions from the Latino community about what kind of business can be open, especially in construction and landscaping. And there's a lot of confusion about this order. So my question is, do you guys plan to have some materials in Spanish?
Well, first of all, we have translated all of our materials for the top 3 or 4 languages being spoken in our county. So you know that we have an office that works with our immigrant population really closely, and that team is out there working hard to make sure everybody understands what we're doing in their language. So that's happening. In terms of construction and landscaping, we look at the order of the proclamation order, and a lot of landscaping can follow social distancing guidelines. So I think that the 2 things that we should be thinking about: one, is this a business of less than 10 people? Can those workers that are less than 10 people working, can they actually practice social distancing? And then the second part of it, looking at the proclamation and making a determination of whether or not you're essential under the proclamation definition, particularly those around trades and around businesses and public works.
All right, our next question is going to go to Katie Peralta. Katie, when you're ready with your question, go ahead.
Sorry about that. I had to unmute myself here. Mayor, do you think that Charlotte and Mecklenburg should have issued a stay-at-home sooner if people, as has been suggested, if people weren't taking this outbreak seriously? That's my first question. My second is, at this point, do you think that the RNC should consider postponing in light of the spread of this outbreak?
So on your first question, I think that we are responding to the community need. We've got people that are really responsible for carrying out the welfare of our community. Our public health director has done a great job. She talked about this, and then we implemented it. Our healthcare systems are giving us information of what they need to be able to be successful in this fight, and we are following that. So I believe that what we've done is appropriate. The second question that you've asked is about the RNC. One of the things about that is that none of us know quite what's ahead of us. So now it's March. The Democratic Convention is in July and the Republican Convention in August. I would expect that those questions are being asked, and they'll be answered by the people that really are dealing with data that's most closely being provided to them. And so I don't have an answer to that, because what we would do is follow the national and federal guidelines, and who knows what the summer will be like.
Okay, our next question is going to go to Steve Harrison. Steve, when you're ready with your question, go ahead.
Excuse me. Thank you, Mayor. A couple of questions. One, have city departments been asked, or are they going to kind of put forth proposals to reduce their budgets for the upcoming budget? And I also wanted to ask, kind of piggybacking on what Katie asked about the RNC. I mean, they have an event coming April 12th, I believe, at the Spectrum Center, which is inside the window of the stay-at-home order. any communication with the National Republicans about calling that event off?
We have talked to them about that event. We have not talked to them since, or I have not personally spoken with them since the stay-at-home order has been in place. When we did talk to them, we said that we would expect them to follow the proclamations that we have or the regulations that we have, just like any other group. So there's no exception for anyone to do this except those exceptions that are included in the order. The second question you asked is about departments and budgeting. I don't know of a year that we didn't ask departments, how could you do work more efficiently and for a lower cost? But that's the city manager's job, not mine. It used to be my job, but no longer, and I'm grateful for that.
All right, thank you, Steve. While the mayor catches a sip of water real quick during this, I'm going to go through the order of the next couple of questions so that everyone knows who's going when. Sudine from the Associated Press, you're going to be up next in just a moment. And then Brett Jensen again, Hannah Smoot, Joe Bruno. There are a couple others who have re-raised their hands, so we're going to come back to you all in just a moment. As a reminder, if you do have a follow-up question for the mayor, you can utilize the raise your hand feature, and we'll be able to get you on. We appreciate that. And at this time, we're going to bring in Sudine from the Associated Press. Go ahead with your question for Mayor Lyles when you're ready.
Hi, Mayor. Can you hear me?
Yes, I can.
Thanks for doing this. My question was, do you feel like the situation in Charlotte and smaller cities like Charlotte is being overshadowed by what's happening in Los Angeles, New York City? And sort of piggybacking on that, are you concerned about potentially having to compete with those larger cities for medical supplies, potentially medical staff?
That's in terms of competition. It's very difficult to think about competition when we're talking about the health and welfare of our country. So I watch Governor Cuomo. I've watched the governor in California and Washington State. We are one of 50, and we're not competing. We are trying to collaborate and make things happen. So no, I don't see this as a place where we're in a competition for either media exposure. What I see us in is a country where we are trying very hard to meet a national need. And our needs in North Carolina, our needs in Charlotte are just like those in other places. So I don't see competition as a part of this.
Okay, Brett Jensen, I had you marked as a follow-up. If you have a follow-up question for Mayor Lyles, you can go ahead and ask it when you're ready.
Mayor Lyles, in terms of, I'm sure you're speaking to the CEOs at Novant and Atrium on a regular basis. Have they expressed to you in great detail just how concerned they are about this situation?
So in our process, the way that we have organized our response to this pandemic is that we have a policy group, and that policy group talks regularly throughout the day, and both healthcare systems have been an essential part of this. I think that the healthcare systems have expressed many of the concerns that you have seen nationally. We need equipment. We need face masks. We need to make sure that doctors are trained to utilize the equipment appropriately. We may need more beds, but right now we are taking that information, and yes, in detail, they are providing it, and they're working with the overall mission of our healthcare systems is to make sure that every patient has an appropriate level of service, and we're addressing their needs. So I would say that those conversations in our policy group are working for us, and they are integral to our success for flattening the curve.
Okay, next we're going to go back to Hannah Smoot with a follow-up question. Hannah, if you still have a question, go ahead and ask it when you're ready.
Hey there. Yeah, I just wanted to ask about the relief fund that the city, the county, and several businesses donated money to when will that relief fund begin to be distributed, and what's the criteria for that?
So I am a member of the Help Charlotte Mech Now advisory board, and we met on Monday. The grants committee the following day, the grants committee met, and so what they have as an objective is to get as much direct funding out there as possible. But we need support. If you would go to the website, www.helpcharlottemech.org, that would really help us. That fund is going to do two things. One, help people stay at home and help people with their unemployment. All of those things are on the table. But we're doing it in a way to try to triage those that have the greatest need right now.
Okay, Joe Bruno, you are up next with a follow-up question. Go ahead for the mayor when you are ready.
Alrighty. Just two quick questions here. Just seeing the numbers spike so dramatically over the past couple of days, how hard has that been for you to watch that happen, knowing that, we're kind of fighting an invisible enemy right now, and there's not a whole lot we can do other than staying at home? And then my other question is, just if you could stress to Charlotteans, why is it so important for people to follow this stay-at-home order?
I'm going to start with the latter question. Why is it important? Is that we have been told by our healthcare professionals that if we can flatten this curve, we will have more capacity to treat everyone. And that is what we're seeking right now, that capacity for treatment and care. So if we can flatten the curve, that's important. And all of us know that this virus is transmitted without visibility, and what we have to do. So the stay-at-home order is important because it reduces the likelihood that anyone that is positive can spread the disease. And so it's very important. For me personally, I have grandchildren and family in town. I am no longer seeing them or visiting them. Let me put it this way. I am no longer visiting them. I often do things like Skype or Facebook Live with them because that's the way to stay in touch. So when you ask me personally what I want people to do, I want them to follow the guidelines of washing your hands, to make sure that you're sanitizing the surfaces, to not visit your family except electronically, and to do things differently so that we can accomplish our goal of flattening the curve. I'm trying to set an example for that. It's important. It's important to our community. It's important to what we want us to be, not just today, but a year from now or 10 years from now.
Okay, Eric Spanberg, when you're ready, go ahead with your question.
I wanted to ask you, you mentioned, everything is on the table in terms of tax rates, bond referendums, other steps you could take. And you've also mentioned several times, obviously, that none of us know how long this is going to last, what the circumstances are going to be. So what are you thinking in terms of timing for yourself and the council and the city staff to begin trying to come up with solutions and addressing some of those financial needs at the same time that you're trying to stave off the virus?
So when we started this process in early March, there were three principles that I established. One is that we would work really hard to communicate openly with our residents. So that was number one. That we would on a daily basis assess where we stood and operate from that daily assessment, and that we would look at this on a continuous basis within every 30 days to kind of repeat, reevaluate, and correct anything that we thought we could have done better. Someone put it really well to me. They said, what are we doing? What could we do that Seattle didn't do? And that's the question that we're asking ourselves every time. And I think that that's been those principles of getting the information out, to daily react and respond to whatever information and data that we're getting, and to know that we're going to do a real assessment every 30 days, that has been a great value to everyone to understand the process. So if you're asking me about the financing and how the city is going to operate, I expect there's going to be a large conversation about that. But we need to do it as we get closer to getting through this flattening of the curve and seeing what our new normal is going to be like. and deal with it there.
Okay, our next question is going to go to Alex Shabbat. Alex, when you're ready with your question, go ahead.
I know you answered a couple examples of what industries, major industries like healthcare and finance won't be affected as much because they're considered essential. What are a couple examples of non-essential jobs that you think could have a big impact on Charlotte because we have those industries in the Queen City?
I'm sorry, I didn't hear you said what after you said that. Can you repeat the question, please?
Sure. Yeah, you talked about some of the major industries in Charlotte, like healthcare and finance, that wouldn't see a major impact because they're considered essential. What are are there a couple examples of non-essential jobs that you think will have to make some pretty big sacrifices in Queen City? Because I think some people are struggling to understand, okay, what are some non-essential jobs?
So let me start off. If I said that that the healthcare and the banking industries that I cited were not going to be impacted, I want to correct that right now. They also have to follow the guidelines that the state has put in place as well as ours in terms of mass gatherings. I've been in several of our retail stores where you've seen the tape that separates people by 6 foot. They've taped it out on their floor that they're only allowing a certain number of customers into the space, a number of employees into the space. So I certainly don't want to say that we haven't had an impact on those essential businesses because they're having to follow a number of the guidelines that we have in place. And so what do I think is really having the impact? You can see it. It's pretty clear. Our restaurants, there are no cars in the parking lot, even for takeout. And so those kinds of things, our entertainment centers, all of the cancellations of our stadium shows that we were having, cancellations in our bars and all of that. So I really think the hospitality industry is taking a large brunt of this. But think about it. I mean, as someone that utilizes a hair salon, a manicure salon, who shops in our shopping centers, and they're closed. So everybody's taking a hit on this. No matter whether you're operating, you're having to operate differently. Or if you've had to close, then you know that you're having to act and do things in a different way.
Okay, next we're going to go to Chandler Morgan. Chandler, when you're ready with your follow-up question, go ahead and ask.
Thanks, Mayor. Just a quick yes or no answer. So just to be clear, for anybody out there who has a question of maybe their employer printed off these documents for them and told them you should have these with you at all times, yes or no, do people need to have a letter showing or a document with them if they're out that they're allowed to be out?
From my understanding, the answer is it is not necessary now.
Okay, next up, we're going to go to Steve Harrison. Mr. Harrison, when you're ready with your follow-up question, go ahead.
Yeah, so I have a question about, has there been any discussion with the hospitals if down the road they need additional space for patients? The city owns a lot of real estate, a lot of buildings. Has there been any preliminary discussions about using some of that space?
You know, that question has come up before, particularly since the governor of New York is outfitting a large conference center space as a hospital. But when we've looked at that, the healthcare systems have not expressed that kind of need. But we haven't gotten to that, a decision around that. We would take that data and information and look at it carefully. But right now, the healthcare systems are working on the idea that they have the infrastructure to separate the virus cases from the remaining parts of the hospital. And as long as they're capable of doing that, we'll continue that. But as we know, this is a very fluid situation. Change can be requested at any time. So we'll just continue to monitor that with the healthcare systems.
Okay, next up is going to be Katie Peralta. After Katie is going to be Diego, and then Emma, and then after Emma asks her question, we're going to be done with today's media availability session. I know several of you have asked for follow-up questions, but because of time and some scheduled things that are taking place, we are going to have to cut our call short. So we do have 3 more questions for today for the mayor. First up, we're going to go to Katie Peralta. Katie, when you're ready with your question, go ahead.
Thank you. Quick question to follow up about small businesses. Does the city have any ability to expand that HELP CLT fund to include small businesses at all? And related to that, is there any way the city can, to take other steps to relieve small businesses, including by, encourage landlords to consider leniency, for example, anything to help them along, since I know that this will be very damaging for several small businesses.
It is very difficult right now for small business people to know what to do and where to seek help. So we're trying to get something on our website pretty quickly that will address the small business definition and where they can go for help. What I've read from the stimulus package and read from several of our websites that are addressing small businesses, that really the idea of rent is a big deal when you're not allowed. If you have a salon and you aren't doing any business, what is your liquidity to actually pay your rent? So I believe that the stimulus package addresses some of those ideas around allowing for rent to be deferred, allowing for renegotiation of your lease with your landlord, and so those are things that are underway, and we don't have an answer specifically, but I'm hoping that the stimulus package gets adopted and signed, and that we'll see some help in that regard. Specific city services, where we've got our business inclusion program on our website. We'll be including additional information about how we can work with our small businesses to assist. And I think reading what's on the website around small businesses, if people would go to those sites and begin to think about, well, what happens if I ask for this, this, or this, so that we can begin to be responsive to that, to those questions, excuse me.
Okay, next up is Diego. Diego, when you're ready with your follow-up question for the mayor, go ahead and ask.
Yes, thank you so much. And another question that we have received a lot from the Latino community is, if workers, for instance, they have to go to a construction site and they have an encounter with police, do they have to say something, or how these kind of encounters are going to be more, proactive in the sense that the community could travel or work without being afraid?
Diego, this is Corey. Because of a technical error on our end in the studio, the mayor was not able to hear almost all of your questions, so if you could re-ask that, we'd appreciate it. We apologize.
Absolutely, no problem. Thank you so much. I was asking this question, we have received it a lot from the community. If, for instance, a crew of people, workers, construction workers, or someone in the community that are traveling, are working in an essential business, and if they have an encounter with the police, so how they are going to manage these kind of encounters? If they are not required to present a letter, and they have to say something, or it's just going to be, police officers when the let them pass? How is going to be those interactions?
In response to that question, we had an immigrant task force that operated and provided us guidance that we adopted as a city months ago. And in our case, what we do is we believe that we are respectful, that we are inclusive, and we encourage the diversity in our community. So what I would expect is that any group of people will be treated the same. Each group should be treated exactly as we have under enforcement, and our enforcement is going to be done through education, dialogue, and asking for voluntary cooperation. And that is what we're doing for everyone.
Okay, and our final question of today's media availability session is going to go to Emma Way. Emma, when you're ready with your question for the mayor, go ahead.
Thank you so much, and thanks again for doing this. I understand that the county and the state have more jurisdiction over a public health crisis like this, but I've also seen some constituents asking for more updates from city officials. Is there a reason there haven't been many public addresses, and do you Mayor Lyles plans to do more in the coming days and weeks?
So yes, I will be doing as much as is needed so that we can maintain what I call the connection between community. We're in a situation now where stay at home is creating a separation, a physical separation. But what we need right now is the ability to come together, to work together, to make sure that everyone has a part of this plan, that we can flatten this curve. So, I have been working since early March with federal officials, our federal delegation, the White House. Many of these calls that I'm making are around how do we deal with the federal government helping our community through the governor or either directly with our city leaders. Then I've also been working with the metro mayors. These are mayors of the largest cities in North Carolina, and since we've done our proclamation, we will see that we've shared that information with other communities of our size, and they have accepted it and are working around it, because all of this is about sharing enough information, getting the right data, the right people in the room to make these decisions, and I'm committed to that. But more importantly, let me just say, this is a time that's unprecedented in our city's life. We've never had a virus. We've done hurricanes and we've done tornadoes and we're even prepared for all of those kinds of physical things. But to be able to cope with something that's unknown, that's transmitted from within each other, it's just been very, very hard. So what I want to do is ensure our residents that we will do everything that's within our realm of authority. So let me say this. I think that our public health director has done an exceptional job. She has led us through this time with grace and fortitude. And I just want everyone to understand that that's an expectation for everyone in this community, to actually stand up with her and the many other people that are making it possible for us to be safe, to stand up and make sure that we can get through this as a city, as neighborhoods in our city, as people that care deeply. Thank you guys so much for what you're doing.
Okay. Okay, well, everybody, thank you so much for joining our call this afternoon. Mayor Lyles, we'd like to thank her for our time. In addition, a number of our staffers who came in the control room and in the studio to support this effort today back at the Joint Information Center as well. We'd like to thank all of our staffers. We are practicing safe social distancing down here at the mayor's orders. So we'd like to thank all of the reporters for joining us today. We will send out the video file to all of you shortly, along with some photos that our staff photographer took. So we appreciate all of you joining. We'll keep you posted on future developments, announcements, or future media availability sessions that the mayor may be doing. So we appreciate all of you joining and hope you have a good rest of your day. Thank you, everybody.